So welcome to you all. It is the top of the hour, so we'll get started. If you could please go ahead and introduce yourselves in the chat as you enter. Please put your name, state, and the injury topics that you work on so that we can get to know everyone in the room with us today. And we'd also like you to rename yourselves. I see a couple of folks are as guests. If you could rename yourselves with your name and your state abbreviation, we would love to see who's in the room and welcome everyone. Great, so next please. So welcome to our State Technical Assistance webinar, and we're very happy to have you all with us today. Next, please. As we get started, I just have a couple of reminders. We are funded, the Children's Safety Network is funded by the U.S. Department of Health and Human Services, Health Resources and Services Administration, HRSA. And we are HRSA's primary vehicle for technical assistance on child safety topics. So anything that's, none of the information that we share today should be construed as the official position of the government. Thank you. Next. We are in Ring Central, so just as a reminder, we have a couple of different controls on here, and if you look across the bottom of your screen, you'll see your mute button, your stop and start video, and the participants list. If you click on the participants list, you'll see everyone's names and then also the raise hand feature there. And if you click on the chat, you'll be able to see the participants and the chat at the same time. Next, please. So we do ask you to continue to mute yourselves when you're not speaking, using that microphone at the bottom left. We will be sharing some resources with you in the chat, so you can check those out there. We are recording the session and we'll be posting this in the next week or so to the site. And please use the chat at any time to ask any questions. Next, please. So my name is Maria Catratis. I'm one of the Child Safety Learning Collaborative co-managers here at CSN at the Education Development Center. And our main speaker today will be Erin Ficker, who is also a CSLC co-manager and brings many years of experience on workforce development. So we are very happy to have Erin chatting with us today. So without further ado, I'll hand it over to Erin.
Thank you so much, Maria. I am so excited to be here as well. And like Maria said, I have been working in workforce development in one way or another for quite a while now. And it really is something that kind of moves from field to field fairly easily. So I'm excited to kind of talk about this as it relates to the framework of CSN. So our CSN framework, as you probably have seen before, hopefully have seen before, is focuses on the three main areas of child safety expertise, leadership and management, and systems improvement. And really, leadership and management and systems improvement in these two areas really are the things we're going to draw on to build our workforce and to think about deliberate workforce development in order to really get to those outcomes and that health impact. So we want to talk today about how do you think about workforce development in a deliberate way. How do you think about who you need to be targeting? What kind of services, what kind of support are those different folks in different places going to need? So that's where we're going to focus, is on this yellow circle there at the top, the workforce development. So let's go ahead and move on. Workforce, I can't say enough about why workforce development is important, but I was able to get it down to a few points. Workforce development means really bringing people up to speed, whether that's in skills, knowledge, understanding, and whether that's about generally their work or specifically to a project. So one of the things why it's so essential is we're going to build the knowledge of our change initiatives. So if we're working on specific change initiatives, building our workforce's understanding of that change initiative, the reasoning behind it, is essential. It increases personal buy-in. So we want people to be invested, and the more we invest in them, the more they invest in the work. So also we want to develop the skills needed to implement and test change. So if we are in the middle of a change process, we need them to have the skills to do the implementation. So that's the actual project, the work, the program, whatever we're having them do, but also to understand that we're testing a change. And then last, it builds really lasting skills that can improve the workforce overall. So the more we invest that in workforce development, whether it's really specific to a change project, whether it's more general, it's going to have a lasting impact on our workforce. All of this information does stem from research that's been done about best practices in implementation and in the implementation of programs. A really lovely field of study known as implementation science. For those of you who are familiar with it, these are really some of the things they've identified as why we need to invest in workforce development for successful implementation. We can go ahead. So one of the first things that seems both obvious and not obvious is, who is my workforce? And in different parts of your injury and violence prevention work, you may have different workforces under different grants, under different programs, under different divisions of your Title V agency, or how you're partnering. Your workforce may look different. So that includes, it can include people who are working at every level. We can talk about people who are working at the government level, like that state government level, your state, whether it's your own agency or your state partners, community-based folks, volunteer organizations, the healthcare systems we engage with, like at every level, we need to think about who do we need to build their skills and understanding in order for our work to be successful and in order for our change projects to be successful. With each, like I said before, like with each program, strategy, and grant, you may have a different specific workforce. So you can't just identify your workforce overall and move on. You really have to think about, for this project I'm working on, for this grant that I have, who's my workforce? Where do they fall? And then the structure of the state system and funding may really be impacting who that workforce is and how you can best build a workforce to implement your work, to implement your new changes. So it may be that you have some control over it, but it may be that there's some structures that impede that. So that's kind of some thoughts around identifying that workforce. We can go ahead and move on. Okay, so there are a variety of ways that state systems function. And I'm gonna go through this really quickly, but I have a visual that's easier. So like sometimes we're passing through money directly to the community level. Sometimes state agencies are granting directly to the community level. And sometimes we have this like what I call a sub-state level, which is really kind of, it can be county government, it can be a nonprofit organization, but it's someone in between the state and the community level that's doing the direct work that is that's supporting the work in some way. We'll get into that in a minute. But then there's also, we can move on to the next slide. So yeah, sub-state is the other level. So I want to show you this in this really confounding visual. This was really hard to put into a visual for us to understand, but I wanted to kind of see if we could look at it all together. So we have this state level, which is, we can think of that as like the state legislature or the agency. So sometimes the state legislature gets funds and sends it directly to the agency. We're really still there at the state level. The sub-state level are things like community or county level government. So if you have a county system, there's some regional systems. So in some states that are larger, there may be a regional system with which you have regional public health authorities, or you have regional education authorities. You may have a regional network that's set up that's non-governmental. Like in some places they have a network across the state that serves regional needs. For example, Tennessee has a network of suicide prevention network. So all of those things, all those different ways that sub-state agencies can look. So that's that sub-state level. And then there's the community level. So just one sec before we get to our arrows. At the community level, it can be anyone, right? It can be the folks who are doing the work. Community agencies, nonprofit agencies, the healthcare systems in the hospitals. With the work I support in the CSLC around sudden unexpected infant death, we work a lot with the hospitals and healthcare systems. So those are often people that are at that level. And then local governments, right? So local governments being towns, cities, villages, sometimes can be county if they're a sub-state in between county. There's a level in between county and state. So those are the kind of three levels that I think of when I think about my workforce. And so let's look at some of the ways that this is set up. So our first arrow is the state legislature sends money directly to local government. Yikes. So if they completely subvert the agency, right? So the state legislature says, we're going to get this funding and we're going to send it every public health agency in the state at county level is going to get dollars based on their population, or every county mental health board. In Ohio, they have these county mental health boards. They just get the money directly. The state agency that oversees that work has no authority of how much money goes there. But also you could have where the state legislature sends that money to the agency, and then the agency makes grants directly to the community level. Okay, so when I'm thinking, if I'm sending the money directly to the community agencies as a state level administrator, I have some more control on what's happening. When the state legislature sends that money directly to the community level, I have less control. And someone's asking where nonprofits fit into this. It's a great question. And really, it really is at multiple levels. So sub-state, you can often have nonprofit agencies that work at a regional level that can be part of this structure, or you could have community level nonprofits. More often than not, it's at the community level. And someone else says the legislature would actually have to fund us. So yeah, in a lot of cases, the legislature is going to fund a state agency, and then the state agency will decide how to put that money out. There are structures, there are state agencies in different areas where the state legislature has formula funding for their state. Okay, so that's the first example. So a second way that this could happen is where state agencies, so state agencies fund a sub-state level. So I'm going to go directly to county level governments. I'm going to go directly to a university and have that university then do that work and fund it out, right? I'm going to have a regional network of suicide prevention agencies that work at regional levels. I'm going to fund them directly. Often, when the state legislature is the one funding the communities directly, we see this set up, right? Where agencies then are funding sub-state level so that they can provide some training and technical assistance to the lower, to the community level. So that's one option, right, where states do that. Another option would be, let's look at our next arrow, would be that sub-state levels fund that community level. So I give either the state or the state legislature gives money to a sub-state agency such as a university, a regional network. I know in Texas they have like a public health regions. So the head of that, each of those regions, or a county level government, or a community mental health board, those kinds of things. And those folks send money directly to and provide funding directly to the community level. So there's lots of ways that that can happen, but that's usually state agencies funding the sub-state level funding the community level. So it's really, really diverse how people do this. So let's look at one more. So that's how those are the different options, right? Not only are those the different options that can happen independently, but they can also happen at the same time. So fun. So let's look. So these are the funding structures, and I want to go to this is the state. We just put up. This should be training. So this is the state structures that are specific to who your workforce is. So as a state, my workforce could be those local community. I'm going directly to them with my workforce development work, straight to them. Another option is that I don't have as much control or influence over that community level for any number of reasons. I'm not their direct funder. They don't have any direct funding. So sometimes these are unfunded agencies at the community level. In that case, I may take my workforce development energy and focus it on that sub-state level, who's closer to the local level, who can provide training and technical assistance to that community level. And then a third option is that the sub-state level provides training directly to the community level. And then again, these all work together. So your funding structure often is going to mirror how you identify your workforce. And this happens differently for different programs in different states. It's very diverse. But it's important to think about this for all of your programs, not just for yourself, but if you're partnering with another state agency to do work, for example, if you're working with the Department of Education and they have regional offices, they may want to work that way. And that may be who the workforce is for a specific project where you're a partner. So just wanted to lay that out as some of the different structures and how we identify our workforce. I'm going to pause because that was like a lot of crazy information and ask you guys this question, right? So who in your work do you see as your sub-state, as your as your workforce? Is your workforce that sub-state level? Is it the unfunded? Is it local community agencies? Is it directly funded? Who is it that is your workforce? If you could.
So,
oh, there we go. Sorry, thanks.
So Erin, it looks like we're getting some comments about most of the programming being from the federal level.
Yes. Mm-hmm.
They're getting federal funding.
Yep.
So it sounds like there's another level on top of.
Yeah. Thank you. And I didn't put that in there because then we had too many levels to look at, but we're assuming, and I should have said this at the top, I apologize, that I'm assuming that if the state legislature or the state agency gets the money, that's coming from the federal government, right? So most of our money is passed through somehow. A lot of our money is passed through from the federal level somehow. So yeah, so a lot of it comes from HRSA to the state. So I've seen Nick saying it goes from HRSA to the state to county, or to the community. Some people saying that subrecipients of federal grants, that they apply through the state. So again, it's like that state gets the federal funds and then it goes directly, some directly funded and some partners who are unfunded. So yeah, so definitely thank you for that clarification. Yeah, schools can be really difficult partners because of the way they're funded and supported, and the way that they often have local rule. So that doesn't mean that they're not part of the workforce you're trying to bring up. It means that you have a different relationship with them as a workforce. Other folks, feel free to unmute.
As I was thinking through this, mostly like my primary workforce are all basically volunteers. And so you have to really provide a what's in it for them. Mm-hmm. So like schools, coalition members that are from other organizations. Mm-hmm. And we've had, through our coalition, we've done things like trainings on how to write a good objective and goal mm-hmm. setting, and how do you evaluate what you're doing. And so I think that's kind of maybe what you're talking about. We Absolutely. Don't necessarily have any money to give them where we sit. unfortunately. So, but those are kind of the groups that I'm thinking of as
Mhm.
far as, my
Absolutely.
workforce, and that I could help develop some skills and knowledge around injury
Mhm.
prevention.
Absolutely. Right. Like sometimes I worked with a state on workforce development for substance misuse prevention and alcohol use prevention. And all the money went straight from the feds to the state legislature and all the way around them directly to the community level. And they had no say in what was being asked of those communities. And so we used to say, you have neither carrot nor stick. So how do you help move all these folks together to see the same vision and to get to some outcomes and results? So sometimes we're working in those really challenging environments where we are working with volunteers or we're working with unfunded communities. I've worked with another state that had funding go directly to a sub-state level, and then that sub-state level worked with unfunded communities, and those unfunded communities, then they had to figure out from the state level, how am I going to get their buy-in? How am I going to move them where I want them to be? So yeah, so there's all kinds of different structures that make it difficult, and the what's in it for me is really important when you're working with volunteers. Okay, anyone else?
I heard a presentation from a potential partner the other day who works with refugees and immigrants, and her largest complaint was that groups are expecting her organization to do all kinds of work without any compensation at all. It's like, yeah, this will be great. We'll partner with you and we'll do this, that, and the other thing and get it done, but no money for you. Just out of the goodness of your heart, join us in this work. And it was a very huge frustration for her.
Yeah.
And I'm about to offer to work with her related to older adult falls, but I can't give her any money. I can pay to train the trainer, but I can't give the trainer any money either. So I don't know how she's going to feel when I finally explain the plan to her.
I know it's difficult. It's difficult when we have those restrictions on our funds, when we have those relationships with partners, and we really rely on them. So we do have to find, what's the carrot? How can we help? And you may find, and we'll move on to this a little bit as we go, but you may find that there's different approaches to workforce development that are more appropriate for different audiences. So coming to a 4-day training is definitely not something that I would ask of a volunteer. Is it something that I could ask of a direct grantee? Quite possibly. So we just think of it in different ways when we have different partners, and we have different stakeholders who are involved. So thanks, that's a great example. Anyone else? Okay. Maria, do you want to go ahead? Should we move on?
Yeah.
Great.
So, Erin, I'm wondering, in your experience, what have you used to gain insight into your workforce needs, and how have you gone about this work once you've identified your workforce?
That's a great question. And workforce identification is really the first step. So for each and every program that I have, who are they? And then really trying to figure out what is it that, and it's two-way street. What do they need? And what do I need for them to know? What do I need for them to do their work well? So that's often one of the struggles we run into is how do we, and someone said it earlier, like, how do I move unfunded folks towards this? And part of it really lies in, how do I get them to do this workforce development? How do I get them to come to these learning events? How do I get them on board? And a lot of it boils down to identifying the need and giving them what they need, not more than they need, not less than they need, and building that buy-in. So a lot of it comes through the assessment process. Great. So I do have a little bit about assessing workforce need. And there are a few places, and I would love to hear from you guys in the chat about which one of these that you have used, about how to identify workforce needs. Really, honestly, one of the first things that you can do, especially if you're doing some direct grant funding, look at the, excuse me, look at the challenges you're seeing. Are you getting grant reports back that show no fidelity to a program? Are you getting incomplete information back? What are you noticing that's not happening? Are you not seeing those child passenger safety seats go out? Are you, what are you identifying? So trust a little bit in what you see in the field. It's not the only place you should be assessing your workforce from, but it's a good place to start. Health literacy is big. So yeah, so there's all kinds of things that you have to kind of start. Where's your starting point? What do you see as the gap? And then you really need to kind of go with further information. So that's when we want to dig a little deeper. If we're working with a state or a regional level partner, ask them the same question you just asked yourself. What do you see? What are you identifying as these challenges? Excuse me. What do you, excuse me, as you're getting further down towards the community level, what are people seeing? Sometimes those regional level folks have a much stronger understanding of what's really going on than we do at the state level. So at the state level, it's easy to say like, oh, people just don't understand how to do, and I'm so guilty of this. People just don't understand how to do this fidelity. They just don't know how to do this program with fidelity. They're just not doing it. Whereas when I get to the regional level and ask the same question, that sub-state provider who'd been working with the communities was like, well, actually, these are the 3, 4, 5, 6 challenges that they run into, which is why they can't meet fidelity. So having those folks who are kind of see the work from a closer level are great, a great value to you. So make sure that you gather information from them. That could be focus groups, it can be informal conversations, it can be surveys, but make sure that you're gathering information from that level as well, especially if they are your primary workforce that you have influence over, right? So if you have a financial or fiduciary relationship with a sub-state agency, make sure you're getting their take. So then, please, of course, ask the community level. Ask the folks who are on the ground, whether they're funded or unfunded, whether they're part of your programs. Ask people at the hospital, why is it that, what is it that you need to help increase the number of car seats that go out? What do you need to ensure that people are trained in communicating about safe sleep? All these different folks, so you can look at that community level and say, what do the schools need? What do you want? What do you need? What do you feel that you're missing? And it's very important that we ask them, what do you want to learn? What do you feel that you're missing? We want to empower people to do the work, and we want people to build as individuals and as part of a larger workforce. So the more that we can get to what their learning needs are, the more we can engage them, and we can start to do that, like what's in it for them. Well, it's the learning that you asked for. You can do this in any number of ways, right? So surveys, focus groups, you can do them from the state level. Do those focus groups with community groups. You can have your sub-state agencies or your sub-state contractors do those surveys or focus groups. You can have outside agencies do that. It's just really important that we make sure we're getting that input from the community and not making assumptions about what their needs are.
Erin, we've received a couple of comments in the chat.
Great.
About some needs, and then
Sure.
and then how to include your partners in this.
Cool.
So Sim, actually, could you tell us a little bit more about how you're assessing health literacy in your department and how it's informing your work?
Well, we are working on it through surveys. We're conducting surveys, and then also we're checking the materials that we're handing out to make sure they're meeting the needs by running them through a platform that will read it and tell you how well it is readable and at what level can read it. And then also, I found it not too long ago, and I sent it over to Jeannie. We tested our Drive Smart Nebraska website, and it was 76% readable. So that was pretty exciting. And a lot of it is, you know, short phrases, not complex words, not multi-syllable words. And so just going through and reviewing some of your information, especially after COVID, and we've worked with so many diverse populations, age groups, all kinds of, you know, things in that, disseminating information and making sure they understand the information that they're getting and how to care for themselves, really highlighted the need then to go back and review some of our other materials.
That's great. And helping the folks at the community level understand the importance of that so that they're communicating in a way that takes into account all of those components that you just mentioned. That's great. So we had another comment.
Yeah, from Joanne about asking partners to participate in the 5-year injury prevention plan. Joanne, can you tell us a little more about this?
Yes, in 2020, we just finished our new 5-year prevention plan, and we had many, many listening sessions and large group meetings with our Injury Prevention Advisory Council and workshops and work groups to draw out information from our contractors and stakeholders to see what their current needs are and project what their future needs would be and how can we best measure the success of each type of injury prevention program, whether it was suicide prevention or older adult falls or rape prevention or sexual and domestic violence prevention. So every single partner had a seat at the table and they each had their own section, but with the guidance of the Injury Prevention Advisory Council and our evaluation specialists, we were able to guide them into a mold for a template. So each section used the same template, but we had social determinants of health for each type of item, and we looked at where these overlapped, and it was just a difficult and long process, but everybody felt like they were heard and everybody felt like they had ownership of the final product.
That's great. And it's such an arduous task to make sure that everybody gets that and that strategic plan is well informed. But it's so worth it. And then like moving from that, like now you have this plan, you have this information about the different agencies and their approaches. They then can take that information and move forward and say, how do I want to bring up the workforce so that they can do this? So that they can do what we're asking. Do they need skills? Do they need knowledge? Do they need tools? And in what format? So having that strategic plan that brings everybody to the same page is so essential. And then it really helps everyone say, okay, now I have this shared vision and I can dig into my workforce and start to build their capacity so that they can do this work and help us all reach our outcomes.
And the strategic plan also blended all the different sources of grant funding so that now we have the same language where certain tasks like teen driver safety overlaps 2 different sources of grant funding. Now we're using the same measurable targets and the same interim targets for both of these grants. Instead of having like offset age groups by 3 years, we have the same age group that we're looking at. And it was just wonderful to see it all come together. And now we have a tool that we can use whenever we're doing our grant narratives. And we're all on the same playing field instead of being like one playing hockey and one playing basketball.
That's so great. Yeah. And you know, now that you all have that shared language, you can also do shared workforce development. If you all are talking about, you know, motor vehicle traffic safety and you're all talking about the same age groups, you can start to blend that workforce and they can see the same things. You can share training resources, you can share information. I mean, that's amazing. I've worked with the state for a long time that has 2 systems for the same work that has not been able to do that. So I'm in awe of your ability to do that. And if they could just speak the same language, then they could harness so much more in terms of building the capacity of the workforce to work together toward the same outcomes, because that's what we're always trying to achieve, right? It's to get to those outcomes and using our workforce the best way that we can to get to those outcomes and having them have everything they need for it. So very cool. I'm very impressed, Joanne.
I don't want to hog the meeting, but I'll finish by saying I'll put the link to the New Hampshire strategic plan in the chat. So if anybody's interested in looking at it, they can take a look.
Sounds great. Thank you. Anyone else? Maria, any thoughts?
I'm wondering for some of our CSLC teams, if you're willing to share what type of information methods you've used specifically around your child safety learning collaborative improvement work. And, you know, were you surprised by what you learned? Was it already information that you had from your needs assessments? Like how did it inform the work that you're doing to improve your child safety work?
And kind of take one more question on that is, did your change project require you to rethink who your workforce was and how you were going to bring them up to speed to employ that change or to make that change? It sounds like we don't have a lot of takers.
Well, frankly, I never thought about the people that I work with as a workforce. So I never, you know, so frankly, I never have done a survey with our schools, or, I mean, we've surveyed them, but it's like, how do you think the program is going and what can we improve on? And so really the only workforce development thing that we've kind of done was with our Drive Smart Nebraska Coalition, asking them how we can better support them. And that was through better resources and tools. And so a website was developed so they can grab traffic safety information and social media posts whenever they wanted to, and to spread the message. And so that's what we gained about that. And they didn't really want a structure of objectives and an action plan. It's more now it's changed its focus to just information sharing group, really, and connecting and networking to push along traffic safety in Nebraska. So this would be something that we will definitely put into our survey that will be going out to our members about workforce development will be a consideration.
That's great. And I think, you know, thinking about those partners and saying, what do you need? You know, like, not just how's it going, what can we do better, but what do you need? How can we help you in this project? And it sounds like you asked that of the coalition and they said, we need more information. And I love that you were really clear about what you provided. And I'm going to talk a little bit about different approaches to how we build that workforce capacity in just a little bit. So we'll talk about different approaches. How, you know, do you bring them to a training? Do you provide coaching? Those kinds of different things.
Well, Erin, I think we were able to bring Jenny in and do a training on PDSA so that everybody was on the same page and had the same tools and knew why we thought it was important, and hopefully it was important to them. So that was a couple of years ago, but still it was pretty beneficial to do.
Yes, that was great. And that is a great example of saying, I'm going to bring up to speed our team on the QI approach, on the quality improvement and change approach, because we make an assumption that because we're immersed in it, that everybody else kind of knows what I'm talking about. And that's just not the case. So even in like subject matter expertise, we want to bring the workforce up to speed. But if we're relying on folks within our workforce at every level to be a part of a change initiative, no matter how big or small, we need to make sure that they A, understand it's a change initiative, and B, they understand the tools and ways that we're approaching it. So having that kind of meeting where you bring people together and teach them about PDSAs, which I think was the specific topic, then that's exactly what you're doing. You're bringing them in. And when you bring people in, they develop ownership. When they develop ownership, they develop more connection to outcomes. And then as implementation science, I mean, this isn't just like me saying this, there's science behind the more you bring people in and up to speed and include them in the process, the more they're connected to outcomes, the more you have people connected to outcomes, the more likely you are to see outcomes. And our outcomes in so much of our work are so long-term that that's hard to understand. So what we do is we do the best we can right now, knowing that those things lead to outcomes. So, I mean, that's a great example. Kim from Texas is saying, in the past, you've used MCH Navigator to better access your MCH staff knowledge, skills, and needs. Can you talk a little bit more about that, Kim? I'd love to hear a little bit more.
Yeah, it's been a while since we did it, but it's a great way to just get what, I guess it assesses your, I don't know, self-competency or how confident you are in those skills that are required in MCH work. Yeah. And then they have courses that you can take, I believe, to enhance those skills. So as a manager or staff within the state, or if you're working with a coalition, you can use those assessments and say, okay, we're lacking in a little bit in material development, or particularly in community assessments. Let's work on that as a group to increase our knowledge and our skill base that way. That's
so great, Kim. And I know you have such a ginormous state, like 254 counties or something of that nature. I got it right. That, you know, you can't be everywhere. You can't know everything. So having that kind of assessment tool is really useful. Having a regional system that can do that as well. And then getting that information up to you, right, up to the state level. And I think one of the things that's important to remember when we use these kind of assessment tools and resources that doesn't just assess, but also provides information, is making sure that we're understanding where are we repeatedly seeing the same, like across the state, are we seeing the same knowledge gap? And if they're using the tools and resources in that, in MCH Navigator or another resource, but that still remains a need. One of the things I hear all the time in workforce development is, well, we told them. But we told them that. There was a training. I think that was in the worksheet. They went to that online course. In response to, they don't know. So here's the two things I would respond to that. And one is, they still don't know. I'm really glad that you've provided that training. They still don't know. And two, maybe that wasn't the delivery method they need, or maybe we need to complement that delivery method with something else. So I love that you are using this assessment. I love that people are getting resources from it. And what would be really interesting, Kim, is to see, what do they say when they first do those assessments? They get some resources from it. They do the assessment again a year later. What do they say? Are there new needs? Are they the same needs? And then how can you, at the state level, start to think about, how do I inform my regional level to get this information and this support out to my community level? That's a great example. Thank you, Kim.
So Erin, what are some approaches that you've used for workforce development? How have you gotten started in this?
My goodness. So it's so easy to jump to one of two things, right? Like, let's do a webinar, let's do a training, or I'm going to give people a job aid. There are a lot of ways that you can approach workforce development, and a lot of it hinges on, what are the needs, who is the audience, and what do I need from them, right? Oh, can we go back a slide? I think we went. Thank you. So I just want to look at this for just a minute, because I think it's really important to think about the different ways that we provide workforce development opportunities. A lot of times we really have in mind, like, I'm going to do a webinar, or I'm going to do something. else, right? So what we want to do is we want to develop a plan based on the knowledge that we've gathered, right? So, you know, we've gathered all this information from our own experiences, from the sub-state level, from the communities themselves, really trying to decide what it is that they need. And the question is, do I need a didactic training? Do I need to stand in front of them and talk and have them do some small group work and then talk some more? Or have I done that and it hasn't worked? Or is that not something that this group can do? They can't come together. They can't travel. They can't take that much time out of their day. They're volunteers. So that may not, so training is one approach. It's really, it's intended for very specific audiences. And then there's technical assistance. And technical assistance, I'm not sure how many people are familiar with the term. I think probably most of you are. But it's really kind of this ongoing relationship with a TA provider or an expert in the field that kind of helps walk you through some of the challenges. So this might be, you may have your sub-state agency service technical assistance providers for your community level, right? To say, hey, let me help you. And it's this long-term one-on-one relationship. Coaching is similar. It's a little different, and it's usually someone who's done the exact kind of work, who maybe is further along in their experience than you are. And they kind of walk you through the work, and you can call them anytime, and they'll kind of give you some pointers and some tips. One of the things that's overlooked, I think, is guidance documents. Guidance documents are often paired with your funding. So if I receive funding from the state of Illinois, which is where I live, and they want me to learn things, they can either put the information in a guidance document, or they can put the requirement that I get the training in a guidance document. They can say, hey, you gotta do this. But that guidance document is like, hey, here's how you maintain fidelity. Here's how you report on these things. So it's kind of just some like, here's what you need to do. Here's our expectations. So if the information, and that depends on the information. If the information is really, it's really, I would say information-based. If it's more knowledge-based than skill-based, doing guidance documents are great. If you're looking to build skills, technical assistance and coaching are really great, because you can work with someone as they're developing a skill and putting it into place. Training is good to start that process, but there's not a lot of long-term skill building that necessarily comes out of training, because it's usually a one-time event. So guidance documents are things you can have with you. They're often knowledge-based. The same with job aids. Like, this is the job we're asking you to do, and this is what you're going to do. You know, and these are the steps to do it. So it's a really helpful thing. So like, you know, I for years had a job aid that I had been given on how to make logic models more readable, and I had it just tacked to the wall by my desk, and I would turn to it and be like, oh yeah, gosh, I should do it that way. So sometimes we can make something really simple that's just kind of knowledge-based. It's reminders. Often these things pair together well. Self-paced training is something that's really great. It's something that people are doing more and more, because, you know, there's no travel involved. They can do it at their own rate. You know, we're all living in the weirdest of worlds. So self-paced training is really great. I'm actually in the middle of a self-paced course right now that I'm doing, that I'm engaged in, about ethics. And it's really lovely to be able to go whenever I'd like to and take that learning and engage in it. So self-paced can be great because it allows people time to absorb information. So it's information that you really want them to like hold and integrate. Self-paced trainings can be good because it allows them to do that. The downside of a self-paced training is the ability to click through and get to the end and be done. So, you know, how well people engage in it is different, but it is another really good consideration of how to provide information in a training plan. Okay, so I want to go on to incentive, or who should deliver the training. So not everybody, you know, I may know all of this, but I may not be the right person to tell you. So sometimes it is helpful for state level staff to meet with community level or sub-state level folks and, you know, provide that training or provide that webinar on the job aid. So sometimes it makes sense to come from your funder, and sometimes it really doesn't. So sometimes bringing in someone else from inside the state or inside another local expert, or bringing in an outside or national regional expert can really help kind of solidify what you're trying to point out, right? You know, you can only be a sage, and you can't, the saying is you can't be a sage in your own land, right? So sometimes you need other people to come in and have that conversation and to do that training or to provide that coaching. I used to work in an agency where we brought in national experts that we paired with our TA providers so that that national expert could give the knowledge and information, and the TA provider could really help guide the agency to get to where they were trying to go. So there's all kinds of different people who can be delivering this. Now I had to do a training on filling out reports correctly and making sure fidelity is being monitored. That a state level staff can do that, right? So there's different, depending on what you're trying to get across, you want to think about who should be delivering that training. And then finally, the other piece I want to talk about is incentivizing training. And people have talked about this, that it's, you know, these are volunteers or these people who don't work for me. Often these people don't work for you. Some of them are directly funded by you. And when you have a direct funding relationship with them, it's often much easier. You can write it into the grant requirements. But so just some key things to think about. Make it easy. So if you're working with a rural population, try to make it virtual if you can, or try to come to that. So do multiple settings, virtual and online. Offer trainings in multiple locations. If you have a big state or even a small state, offer, if you want to do in-person training, which is, you know, very impactful, offering it in multiple locations so people don't have to travel greater distance or stay overnight, those kinds of things can really incentivize people's participation. If you say, you know, hey, we're going to have this training, it's going to be in Chicago, I want everyone from downstate to come and be here for a 2-day training. The folks downstate are not going to want to come. They're not going to send enough staff. But if I say I'm going to offer one in Chicago, in Peoria, and in Cairo, then we're talking. Then I can bring people around, and they also feel like they're respected and that they're important. Sometimes if you have the opportunity to provide CEUs, do it. People love them. They'll come and they'll stay the whole time because they have to get the CEU. Continuing education credits are not easy to come by. You can offer someone a certificate that said they were in a training for a few hours. That's great, but it's not the same as a CEU. So look into what kind of CEU people would want and how hard it would be for you to get that. I used to work in an agency where our trainings had CEUs, but they had to go through a very stringent process to be approved for that. Like I said before, include it in your grant requirements. There's no incentive like money. If you receive this funding from me, it's required that 3 or more of your staff or 20% of your staff are trained in these 3 things, come to these trainings, do these online things, use these job aids. You really want to speak to people's internal motivation. And so we talked about that when we said, when you're assessing, assess for and ask them, what do you want to learn? And then speak back to that, right? So if they say they want to learn this, they want to learn X, Y, or Z, and they want to learn it because it really will improve their community. Speak to that motivation around your community needs to ensure that this outcome, you know, we move towards this outcome, and your work here will get us there, and here's what we want to do to help you get there. So really speak to their motivation and get them engaged, and then ensure that trainings reflect both your needs and the needs of those that you've asked. Never ask someone what they want and then ignore it. So if you're going to ask the community level or the sub-state level, what is it that you want, and then you just come in with what you want, that's not going to read well. So you want to incentivize participation, you want to make sure that you're getting what you need and you're reflecting that to your audience. I need, the state needs, this project needs, blah, blah, blah. We're trying to get to this outcome, and X, Y, and Z is going to get us there. That's why I'm training you. But also, I want to talk to the needs and desires of those at the community level too. Like, you've identified this is important to you, here's how we're going to get there. So ensuring that you're reflecting both of those needs is really important. So incentivization is key as you develop a plan for workforce development. I think
Yeah, before we get to questions, I actually had a thought, Erin. You know, when folks attend trainings or have technical assistance that they find extremely helpful, and then tell other folks that they've attended these trainings and technical assistance that were very helpful, it often helps build more interest within the workforce. So even if you're starting off with a very small group of people, doing that workforce development really well with that small group of people may create other opportunities within your workforce.
That's a really good point. And I think the other piece, and we're gonna ask you to do it here, but the other thing that's really important is evaluating what you do. Asking people if they got what they needed, how did it work, did you like it? Someone's always gonna say the room was too cold, someone's always gonna say they wish you'd had coffee, but at the end of or the speaker said too many times. Can't tell you how many times I have read that in various evaluations, but those evaluations are gonna be golden to you if you see we had a really well evaluated program and then we really saw people implementing that work. Okay, that's the one I'm going to stick with. If you are getting feedback that like, oh, I couldn't stay for the whole thing, it was too hard, I can't be there for 4 days, but I liked what I heard. Those are the kind of evaluations that help you understand what's happening. So I really encourage you to find a way to evaluate the workforce development work that you're doing. We're going to evaluate our workforce development work that we're doing. We're going to ask you to complete an evaluation, and it helps us grow. It's part of our change work, and I would encourage you to add that as well.
Do we have any questions for Erin or for myself and Jenny as well, since we're all on the call?
We're all here.
We're all here. All right. Well, if you do have any questions, please feel free to reach out to us at any time. I put the TA request form in our chat, so you can always go to the TA request form. It's also on our website, and request TA. You've heard from a couple of examples from Jeannie. We've done this with Wisconsin as well, and with some of the smaller groups from different states. We do provide technical assistance to very specific groups of people, and hopefully that will help with your certain aspects of your workforce development. In the interest of continuous quality improvement, we practice what we preach. We have our evaluation on the screen now. That is a QR code directly to the evaluation. So if you want to take out your phones and scan it, you can respond to it pretty quickly. And of course, if there's anything else that you'd like from us, you can visit our website and contact us at any time. Thank you, Erin, so much for sharing your workforce development experience with us. And we hope that you all have a wonderful day, and that you all stay safe. And we'll see you again in 2 months for our next State Technical Assistance webinar. Take care, everyone.
Thanks, everybody. It was great talking.